Welcome to Talking Health with Dr.Laz, your favorite health program on television, reaching you as usual from Nigeria's capital city, Abuja. My name is Dr.Laz Eze. Yes, this week is World Glaucoma Week. From March 6 to 12, World Glaucoma Week. The World Glaucoma Association and their partners, including World Health Organization, International Association for the Prevention of Blindness, as well as many other groups, professional associations around the world that are very much interested in our sight to make sure that nothing happens to our beautiful eyes. Yes, the theme for the day is "The world is bright, save your sight." And on the show today, we are going to be explaining what glaucoma means. We have an expert, that will be talking about it. And as you can see, I'm dressed in a certain way. I'm in a hospital setting, and we are going to demonstrate it, and you know what to do. Of course, the second segment of the show, we are going to have an official of the Federal Ministry of Health who is going to talk about the policy framework as well as the plans of the ministry to make sure that our sights are intact, and of course, none of us gets blind through glaucoma and other possible causes of blindness. So don't leave. So stay glued to your TV. We are going to be right back, but don't forget please to watch our previous episodes, as many of them as you like and as many times as possible, and stay informing your health and keep informing yourself about health. So we'll be right back after this break. Welcome back to Talking Health with Dr.Laz, your favorite health program on television. Yes, as you can see, we are in the clinic, ophthalmology clinic or eye clinic, in a more simpler way, with Dr. Eze, a consultant ophthalmologist. Welcome back to the program.
Thank you very much, Dr.
This is her second appearance on this show. A lot of our viewers really enjoyed the session we had.
Wow, awesome.
Okay, and I know they can't wait, to hear you again.
Okay.
So she's a consultant ophthalmologist at Federal Medical Center here in Abuja, and also a North Central rep at the National Eye Health Committee and a member of the National Steering Team of the Make Our Hospital Work campaign. Different hats.
Oh, fantastic. Yeah, it's a lot of work to do. Multitasking.
Okay. Yes.
Yeah.
So,
thank you very much.
What is glaucoma?
Okay. Thank you for having me back on the show. Glaucoma, simply put, is a disease of the eye that targets the optic nerve. The optic nerve is the wire that connects the eye. Okay, so we're going to be using this schematic representation here. The eye, this is the optic nerve, to the brain. So what we see on the outside is picked up by the optic nerve and relayed to the brain, interpreted, and then we know what we are seeing.
Okay.
So glaucoma, it's simply a build-up of pressure within the eye from resistance of flow somewhere around here in the anterior chamber here. And that build-up of pressure compresses the optic nerve fibers, and they die bit by bit up until the point vision is affected. Okay,
so by that pressure is more like pressing.
A mechanical pressure.
Okay.
Yes, right on the optic nerve fibers.
Okay.
And because we know about nervous tissue,
yes,
they don't have tensile strength.
Yes.
So under just a little strain and stress, they give way, they die.
Okay.
Yes. So that's what happens.
So when that happens, there's blindness, right?
Yes. Once a significant amount of the optic nerve head is affected, vision is impaired and blindness occurs.
So it's a gradual process?
Oh, yes. Glaucoma is a silent thief of sight, such that glaucoma causes painless, irreversible loss of vision.
Painless?
Yes.
Irreversible
loss of vision.
So the person will not feel anything?
Most of the time you won't feel anything, particularly with the open angle type of glaucoma.
Okay.
It just creeps up on one gradually, and then they just feel they got suddenly blind. But that didn't happen suddenly. It had been in the eye all along, but because they never got to check with the ophthalmologist, they didn't have an idea that it existed there.
Wow.
So that's why we are having this awareness.
Right.
A week-long awareness every March on an annual basis to heighten people's consciousness to the fact that glaucoma exists. Please go and check your eyes.
Especially given that it's not reversible when those
Fantastic,
that
very
happens.
important point. We can't turn it back. We can't gain vision after it's been lost. Okay, unlike with other diseases in the eye where vision is gone, you can intervene surgically or otherwise, and vision is restored. With glaucoma, once blindness sets in, it's a very, very difficult point.
Well, so what are the causes or risk factors to look out for, given its silent nature?
Yes. Glaucoma doesn't have a single cause, so I'm glad you talked about risk factors. The things that we need to watch out for in an individual. One person may have 2 or 3 or a couple of them. Putting them together, that person now has a higher chance of coming down with glaucoma. The black race compared to the white or the Caucasian race, we are at a higher risk of coming down with glaucoma. Okay, age, individuals who are above 40 years old. Okay, yes. I'm sure you're beginning to fit into it,
Gradually.
Yes, yes. A family history of glaucoma or blindness from glaucoma in a first-degree relative, that heightens the risk by a very high margin.
Who is a first-degree relative?
Who is a first-degree relative? A father, a mother, a brother, a sister, or a child.
So if any of
someone
them
who I am
has
directly
glaucoma,
related to by blood.
Okay.
Not a cousin, not an auntie, not an uncle.
Okay.
So somebody that I am directly related to. Once that person we can identify in our family already has glaucoma, all of us need to have an heightened consciousness that we need to keep checking, because any of us could possibly come down with it.
Wow.
Yes.
So is there a role by diabetes mellitus? Does it pose any risk?
Yes. Diseases like hypertension, diabetes are associated, okay? But just the way we'll talk about glaucoma as a non-communicable disorder, hypertension and diabetes as well are non-communicable disorders. So I can't sit down with you and contract it, right? How do I know I have it? I need to go and check.
Okay.
So check regular blood pressure checks, regular fasting sugar levels. You need to get checked consistently so that you are able to know, do I have these other risk factors that could put me at risk? Yes.
And of course, diabetes has as a complication its own eye complication.
Oh, sure. Independently, diabetes can cause irreversible blindness.
Yeah.
So we must all
damaging
get
those
checked.
blood vessels.
Sure.
Okay, are there signs or symptoms that someone might feel that could suggest something is about to happen?
Interestingly, with primary open angle glaucoma, there's really no sign. It's just silent there.
Okay. So we wouldn't want to go into these classifications because they're a bit technical.
Yes.
Medical story might get you more confused.
Yes.
So when she mentions it,
Yes.
primary open
so
angle
primary
and all of that,
open means that there's nothing in the eye causing glaucoma. Okay? And then also, the channels through which aqueous flows, the water that's in the anterior part of the eye, those channels are open. So that's kind of, once we see glaucoma in such an eye, that the channels are open and we cannot find any other cause for the glaucoma, like maybe trauma or any other issue, then we say that eye has a primary open angle glaucoma.
All right. That's great. Perhaps the medical folks will find this very much interesting. So is there any treatment? Or maybe before we go to the treatment, what are those checks? Because you keep emphasizing the checks, they need to check. So what are those checks and how often should people go for it?
Very good. Particularly if you're black and you're above 40, please go to an ophthalmologist today, now. Use the opportunity of this week to check your eyes. Not a pressure check, please. Because typically, they just say, I went to the mall, there was an eye clinic in the shopping mall, and I checked my pressure. Please, that is not a glaucoma check.
And the pressure she's talking about is like intraocular pressure, the pressure in the eye.
Yes, the eye pressure. Please, that's not sufficient enough to say glaucoma does not exist in this eye. You need to ensure that the ophthalmologist uses the appropriate tools to check the back of the eye.
Is this that tool?
Yes, this is a slit lamp. This slit lamp biomicroscope means that it's a microscope that is adapted for use to check the eyes. So the operator or the ophthalmologist stays on this side using this.
We are going to demonstrate it actually.
Yes, and checks the patient on the other side.
This is an opportunity for me to check my own. With you on the other side, with me as the patient sitting here.
So Dr. Laz gets to check automatically. Yeah. So please check your eyes annually, once every year. Very important. I've told you who can check it, where you can get a proper check. So most of the time, a general hospital, a tertiary hospital, a teaching hospital, please. Federal medical centers, you're more likely to find an ophthalmologist there and get checked.
Okay. Would an optometrist, because people may want to know, okay, without an ophthalmologist, can we meet an optometrist for this kind of
optometrists
check as
can
well?
do a very good fundus exam because they are primary eye caregivers. They have been trained and they are good enough to check the back of the eye. Once they have a suspicion, they refer to the ophthalmologist.
Okay.
So yes, they can do that, particularly in many areas where we don't have ophthalmologists on ground. Yes, or in that setting, then optometrists can come in and suspect and refer.
Okay, let me explain that part. Optometrist is an eye doctor as well. That's in this university, just study the eyes.
Yes, a visual science doctor.
A visual science doctor.
Yes, a visual science doctor.
Great. Yeah. Then the ophthalmologist first trained as a medical doctor and now went for specialist training for like 5-6 years. 6 years.
Yes, in ophthalmology.
That's after youth service, writes exam, goes to study the eye for another 6 years.
So we do the optical aspects, the medical aspects, and the surgical aspects of eye care during that 6 years of the residency in ophthalmology.
Right.
So that's an ophthalmologist who ends up becoming a consultant and a specialist in the field.
Okay, so the treatment now.
Okay.
What are the options?
Yes. So having discovered that there's glaucoma in an eye, the options, first of all, the target is we want to reduce the pressure in this eye, because intraocular pressure is the only modifiable risk factor in many cases, because we can't change the race, we can't return the age back, we can't change our families, we can't change our bloodlines. So the pressure in the eye, once picked up as high on measurement in millimeters of mercury, would guide us as to how much of it we need to drop in a patient. And we can use agents like medicines in bottles, eye drops, to drop the pressure. We can also, there are tablets also that are specifically used for that purpose as well. Laser therapy too can be used to manage glaucoma, and then we can also use surgery. You need to qualify for surgery. So you see your ophthalmologist does an assessment, and based on that assessment, they will tell you, okay, this is what we think you require now, and they move on with your agreement, on with the line of management.
Okay, that's very exciting. We're going to take a break, but not without me having to take advantage of this opportunity to get my eyes checked, so that I'll be sure I'm safe. And like she said, at least once every year, from 40 years and above, see an ophthalmologist or an optometrist, any eye specialist, to make sure that they check for glaucoma. So let's bring on the sip. Wow, thank you very much, Dr. Beetle. I had a free eye check and I feel good.
Okay, you're most welcome, Dr.
Yes,
Laz.
Dr. Beetle is a consultant ophthalmologist at the Federal Medical Center, Abuja, Nigeria. And I really thank you for being on the show and educating all our viewers about glaucoma. So,
you're most welcome.
Yeah. On the second segment, we are going to be interviewing a senior official of the Federal Ministry of Health of Nigeria. We're going to know a bit about the new national eye policy, as well as other plans the ministry have to ensure that we keep seeing the beautiful world. And that's going to be after this break. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we are still in the World Glaucoma Week, and the first segment, you must have watched the interview I had with Dr. Eze Eze, a consultant ophthalmologist at the Federal Medical Center in Abuja, Nigeria. So this second segment, I'm joined by a senior official of the Federal Ministry of Health, the acting head of the National Eye Health Program under the Department of Public Health of Nigeria's Federal Ministry of Health, Dr. Chimezie Obimbam. You are welcome to the program.
Good evening, viewers. It's nice to be here.
Thank you very much. So, is National Glaucoma, the Global or World Glaucoma Week. So, what package does the Federal Ministry of Health have for Nigerians this week and beyond?
This week and beyond, well, we all know that glaucoma is responsible for irreversible blindness. It's the leading cause of irreversible blindness worldwide. In Nigeria, we have about, from the National Blindness Survey, we have 16.7% of causes of avoidable blindness are caused by glaucoma. So we believe that at this point in the Department of Public Health, under the leadership of Dr. Mr. Lesoko, ably guided by the Honorable Minister of Health, Dr. Esage and Hanire, we believe that it's time for us to take the message to Nigerians and know that is the leading cause of irreversible blindness, and essentially encourage Nigerians to treat it and avoid the blindness from it. Furthermore, we also believe that at this point, awareness creation, because information is power, and once you have information at your armament, you are likely going to avoid having problems. And that's key to public health, because we believe in prevention. So once we prevent blindness from this disease, which is a silent thief of sight, then we've gone a long way to arm Nigerians to be economically productive.
Okay, usually at this time of the year, partners, governments at the state and federal do put out screening programs and activities. Are there free screening activities for glaucoma anywhere in the country as part of the World Glaucoma Week?
Yes, those of us who are in Abuja here and environs, we have a screening that will be ongoing in National Hospital within the week. That has started already on Monday, and it will continue within the week. We also have one that will be going on in University of Abuja Teaching Hospital, also within the week. Then furthermore, there will be screening at somewhere in Maraba at the health center in Maraba. So, and different the eye ophthalmology departments of different tertiary teaching hospitals have been encouraged to do screening as part of their corporate social responsibility for areas they subserve, because we know that glaucoma is a silent thief of sight, and most often than non, asymptomatic symptoms come in when about 50 to 70% of vision has gone.
Has been lost.
So what we encourage screening. So with the screening, you pick it up at early stages, and such you prevent blindness from the disease.
Okay.
Yes.
So that sounds good. Recently, the Federal Ministry of Health launched the National Eye Health Policy, and the first, according to the report, what we heard from the Honorable Minister of State, who spoke that day, Senator Mamora. So what are some key provisions of this National Eye Health Policy?
The National Eye Health Policy, like you said, is the maiden edition for the country. Incidentally, it actually
came very late.
Yeah, it came late, but then we are happy that it took off.
Better late
than never, So we believe that is a framework of which governing eye health in the country, and it has various policy trusts. You have leadership, you have leadership and governance, you have strengthening the referral system, you also have equity as enshrined in it, you also have a coordinating partnership. So all this, when you look at it, it's all geared towards ensuring that the sustainable development goals are attained. And we believe that once the states and the national level, once we can be able to key into this, the attainment of universal health coverage will be achieved through eye health, because these days...
I actually like the fact that it was said that all the states, had keyed in that they will be adopting this policy as a working document at the state level.
Yes.
So, but now talking about glaucoma and the availability of these services, what efforts or strategies, does the Federal Ministry of Health and working with the states and the various partners have to ensure that routinely, at our primary healthcare facilities, people can go and screen, for glaucoma, as well as other eye care services that could be provided at the primary healthcare level?
Yes.
Is there anything like that we are working to see happen?
The Honorable Minister of Health, Dr. Sage Hanire, primary eye care is at his chest. Is as part of primary health care, essentially. Primary eye, if you recall, sometime last year, during the World Sight Day, he spoke about primary eye care being integrated into primary health care. And our strategy in that line is that we are empowering the primary health care workers, the non-ophthalmic health care workers, to do screening, ensure referrals, and also that helps to strengthen the referral system, because we believe that once the secondary system care is strengthened, then the tertiary level of care won't be as bogged as it is now.
Right.
Now,
so primary system, the primary healthcare, secondary, the general hospitals,
and all that. So once they are strengthened, yes, hospitals, yes. So once for viewers to understand. Okay, better, thank you very much. So once that part is strengthened, the primary and the secondary level care, we see that the tertiary will now do the research and development, and also manage cases that ordinarily most people will travel for medical tourism.
Dr. Bimbo, sorry I'm cutting you. Specifically, what are those services we should be expecting at the primary healthcare level? Are the health workers be able to do fundoscopy to check through the eyes to make some basic diagnosis, or they just have to use signs and symptoms and make referrals to general hospitals or private hospitals, for higher level of eye care?
Okay, thank you so much. If we have a medical doctor in charge of primary health care, of course, basically, even in medical school, we are trained to do fundoscopy. So we also retrain the person on the act of fundoscopy. However, the non-medical workers there, what we are doing is actually trying to strengthen their capacity by teaching them the signs, symptoms of few eye diseases, and possibly refer, as a case may be, to this next level of care. And in the next in that line, there are basic eye problems they could understand and treat, at that level. And consequently, the Honorable Minister had instructed us to train national master trainers. We have 12 of them in the country, 2 per geopolitical zone, and these people are supposed to train the trainers who are within their states of jurisdiction. And it surprises you to know that at the moment we have trained primary healthcare workers in Kogi State, supported by Sight Savers. So these are areas where we are trying to strengthen the primary healthcare level under the directive of the Honorable Minister, and we are getting results in that line.
Okay. All right, thank you very much. The states and local governments are even closer to people and have more responsibilities to perform when it comes to primary health care. So we do hope that with the National Eye Health Policy in place, they are going to domesticate it and also, ensure that it's implemented. I'm aware about the strategic plan that the ministries will be working on. We look forward to having that. We may not have time to talk about it, but yes, the Federal Ministry of Health and partners are also developing strategic plan to ensure the implementation of the new policy. So Sight Savers has been a key partner of the Federal Ministry of Health, and they have this message. Just watch it before we close the program.
We at Sight Savers are very keen on promoting eye health and promoting the prevention of avoidable blindness in Nigeria. For a long time, we've been working in different areas in control of neglected tropical diseases, cataract services, and other forms of blindness prevention. But recently, in the last couple of months, we have included glaucoma services into our preventive programs. So right now we have a project we're executing in Nigeria in collaboration with the University of Abuja Teaching Hospital, which is the Keep Sight Glaucoma project. And what we want to do is to incorporate glaucoma routine diagnosis and treatment of early case glaucoma to prevent the rate of blindness as a result of untreated glaucoma in Nigeria. Now, why is glaucoma important to us? Glaucoma is the second leading cause of blindness and the most important or the most frequent cause of irreversible blindness. And what that means is that once a person has glaucoma and it's left untreated, the person is going to progress to blindness and we can't do anything about it. So this week is the World Glaucoma Week. Starting from Monday to Friday, we have a lot of events that we have lined up, and we're trying to create awareness on glaucoma and the devastating effect it will have on individuals. We're here in Gwagwalada Area Council, where we're screening the population to detect cases of glaucoma and refer them to the hospital for early and timely treatment. We have had, we're partnering, like I said, with the University of Abuja Teaching Hospital. We have personnel from the hospital who are here working with us, and then we have the support of the Federal Ministry of Health as well. So we have a handful of staff here, and we have a high turnout of patients who are available for screening, and we're doing our best to ensure that everyone gets the attention they require.
Thank you very much for watching Dr. Chimezie Obimbam, Acting Head, National Eye Health Program. He's also a consultant ophthalmologist. Thank you for being on the program today.
Thank you very much, viewers. And thank you, Dr. Laz, for having me.
All right, and thank you, our viewers, the production team, and everybody involved in this. We'll see you same station, same time next week. My name is Dr. Laz Eze. Bye for now.